as everything begins or finishes at some point in mountain, we'll use this as our frame of reference. We're going to step out with your right foot out to the side as we get into the next pose. We're in pose number 10, warrior number 2. Where arms go out to the side parallel to the horizon and the front knee is flexed. The back or posterior knee is rotated in a little bit. The back foot is turned in about 45 degrees. It's always good to encourage your participants. Look over your right shoulder. Check out the back hand. Look over your front shoulder. Look out the front. So Manuel, turn and look at this hand and then turn and look at this hand. So you're really aware of how well their arms are positioned in relation to gravity. Many times you'll see this, many times you'll see this. So you want to make sure that the arms are parallel. Wonderful to do this in the pool because in the aqua environment you always have your hands parallel to the horizon. Common misalignments, the front knee sometimes caves in or goes to one side or goes past the toes. So you want to find, once again, before the arms, the stability of the lower body. Take the tailbone, point it down, really help feel the opening up of the inner thighs. When you're in this position, you'll see in the notes the A level or the regression, but you can always find a deeper pose by going a deeper in knee flexion, taking more space between the feet, and making sure that the arms are sort of parallel to the horizon. Make sure obviously that you continue to breathe, the pelvic floor is engaged, and the navel pulls back and down. The difference between this, I just will say while we're in Warrior 2, and Warrior 1 is very little with the lower body. The S or stability here remains the same. In fact, stay looking this way, Manuel, and bring the other hand here. And all of a sudden, we're into a Warrior 1. You could take the thumbs to the heart, or take the arms over into the air and add a little mild back bend, and Warrior 2 in the frontal plane becomes Warrior 1 in the sagittal plane. Bring your arm back up here, and let's go ahead and turn towards our friends who are watching as we go from number 10 to number 11, the reverse warrior, which we already had in our first class this morning. So let's take this hand and put it on the back leg or on the hip to make it even easier, and then take this arm into the sky. So the upper body now is engaging in lateral flexion. There's no change in the lower body S or stability. How do we make this more challenging? We can actually look at Manuel, who lowered his hand, increasing the range of lateral flexion, opening up the rib and hip connection on the right side, contracting it more on the left side as you see it. How to come out of it? Very slowly engage in lateral flexion concentrically against gravity, because the temptation is always to rush that third phase of every pose, which is the last phase, right? Moving out. And that's potentially where some people could get injured, and we would never want to have that happen. We want to encourage them to move in slowly, maintain it, and move out slowly. You'll also notice in the M level of what they could do with a chair for a modification or regression using props. Moving into a Warrior 3, we're already in the setup for the lower body. So this will be a quick review of back foot, angled in about 45 degrees. Now the upper body is going to turn in the direction of the vista or the vision, or the Sanskrit word, the dristi or gaze. And then we're going to hip hinge and angle forward. Notice how the back foot can stay on the floor but turn around so that you feel a little bit more in alignment. So all the joints point in the same direction. This is a regression or an A-level approach to the Warrior 3. How can we make it more challenging? Keeping this knee flexed as a regression, I'm going to invite you to put your hands on this thigh and then try to get the back foot off the floor as you hinge forward. You counterbalance, teeter-totter your weight, and then if you need to touch down, you could lift for a few breaths, touch down, lift for a few seconds, and touch down. The next progression would be to bring your hands by your hips, palms up, and now you have a short lever, one-legged unilateral balance position. As Manuel showed you in our earlier experience together, the long lever version of this is to angel or abduct the arms forward all the way out in the frontal plane towards the area in front. Things you want to avoid: taking the face and the arms opposite each other and extending or hyperextending the knee. Put the back foot on the floor and lift up, and from the side position, I'd like you to pay attention to this in all yoga positions when you have the arms overhead. Check this out. Think of the face as a painting. Think of the arms as a frame. Your goal is always, if you choose the long lever option in this position, to keep your Mona Lisa in her frame. In other words, so if I looked at you from the side, exactly like this, I should never be able to see your ears. What you see often, can you just show them, is where their head goes forward, the head goes back, and once again, we never recommend in Hatha Yoga demonstrating negatively what we don't want, but for purposes of this instructor training AFAA course, we will show you what to look for. Let's hinge forward into Warrior 3 with your arms forward. Back leg comes up. Notice how sometimes, let's show them what they often do wrong. Notice how you can see his ears, so he has his head forward. Sometimes they teeter-totter. Sometimes they'll take the head down and the arms very high behind. That's not in alignment either. And notice how the back toe sometimes will turn out or in. We never sacrifice range of motion in any yoga posture for the purpose of the posture. And I'd remember that always. To come out of this, the back toes go to the floor and we extend and come back up with the arms overhead, or if they were at the side, they could come to the front thigh and come up. That's a great example of how to use the same lower body setup for Warrior 1 and Warrior 2 and Warrior 3 and Reverse Warrior. To summarize all of those together, right before moving on, let me give you one additional tip. Because the front foot is pointing forward in the sagittal plane and the knee aligns following an imaginary line over the middle toe, just before we move on, notice this. It is possible to recommend some of your newer classes and clients to angle the back foot into a more neutral lunge position, which some people call crescent. So go ahead and turn the foot, Manuel, to more of a lunge, keeping the heel off the floor, exactly like that. Why? When you turn the back heel out, this hip is going to follow it. If this hip follows it, you have what I call hip indecision to the newer yogic novice. One hip is trying to point forward in the sagittal plane, the other hip is pulled into the transverse plane, and it's sort of taking the body out of alignment through a traditional setup nonetheless. What are you saying? Sometimes when we first teach Warrior 1, Warrior 2, Warrior 3, and set up for other poses like triangle, in the very beginning, it's a wonderful thing to have people point all joints in the same direction to understand what alignment is before, now turn out that back foot, getting into a position where your hips and angles are actually doing difficult and oppositional things. Let's turn back towards our friends watching and walk, crawl, or jump your feet together. So we get ready for extended sideways. We could have stayed where we were or start in mountain pose as we look at number 13. Extended sideways has a lower body, a wide base of support stability, but the upper body engages in flexion. There are safe ways to do this and sort of advanced ways to do this where we get people who are very skilled able to take their hands out of this. Follow along, we'll get you there. Walk, crawl, or jump your feet out as if you were ready to start a Warrior 2 or an ankle or anything over to one side. The feet are forward now, angle everything over to the right side, and your hands come out parallel to the horizon. Now you want to check in with the pelvic floor and the core and everything is engaged before we move on. Now we're going to have the upper body engage in rotation. So we turn in the direction of this, and now let's extend the supporting knee if that feels comfortable for you. Let's take the hands to the thighs and gently guiding the spine into flexion, supported by the hands. We trace the hands down the leg and try to get the nose towards an extended neutral position. If you have no pain or discomfort here, this may be where you begin or finish the first couple weeks you practice or for your lifetime. The progression to this would be to add flexion as you see in the photographs. Slowly, with the hands, we lower the nose towards the knee. If you get your nose to touch the knee, good for you. If your nose stays up, good for you. I respect your individual boundaries, but notice how he has used his hands on his leg to avoid unsupported forward flexion to control the degree and the timing with which he flexes forward. Now slowly extend the spine, using your hands come back to neutral, and then push yourself up, and let's show our friends the progression of this. Take your hands out to the side like an airplane. Rotate to one side, and with core connection very extended, we're going to angle forward, not flexing but hinging forward like a table first. Notice this nice neutral position. Without the hands, it's not unsupported forward flexion because he has extension from the spine. Yes. Now he's going to take his left hand to the leg, slowly lower into flexion now, all the way down nose to the and bring the hands behind his body. Now here's an option. He can touch his wrists. He can actually do the whole Namaste mudra, which is yoga for the hands. Fingers pointing down as he first did, fingers pointing up as he did now. He was in neutral, and he can place his nose close to or onto the knee. How would we come out of this? Lift up into extension using the spinal erector muscles. Great core strengthening for those for whom it is appropriate. AFAA question number 5. And from here, lift up into full body extension, and then take the hands out of it. It could unrotate, and then twist towards our friends who are watching. Remember this, that if you want to put the hand cross or hand touch after the flexion or before the flexion, that's up to you. But that is called extended sideways, which is really a wonderful pose to take the body learning how to hinge forward when the feet actually are not pointing in the same direction as the spine to start. And then we angle them. Number 13, extended sideways. Let's walk, crawl, or jump our feet into a standing mountain, just because we're going to try the next asana, triangle, on the other side. We will walk, crawl, or jump the feet back wide to the other side, and now I'll angle everything over here to the left side for variety. We're pointing everything towards the left side of the room, and we're going to take the arms out to the side as we work on upper body mobility with lower body stability first. Pelvic floor engaged, navel squeezes up and in, and let's bring your hand separating the ribs side to touch me, and then go back neutral. Bring the backhand up a little bit more, come back to touch me. Notice how he's lubricating the upper body, getting the upper body in a preparation movement. Come back center. Then after the last one, when it's available to you, we float as a feather down in triangle, and the top hand lines facing us as we're facing you, where the thumb lines up with the mouth. Every triangle or trikonasana pose in yoga has 3 triangles. The first triangle is formed by this top finger and the big toe of each foot. The second triangle is formed by from the pelvic floor area to each heel. And the third triangle is formed by quadratus lumborum, lateral flexion, arm and leg. Those are the 3 triangles. Let's show an easier version of this, Manuel. How could we make this easier? The hand could touch the floor or the leg or behind the leg, or come up and touch the leg, just like this. We could also flex that front knee, because sometimes this will assist people into getting into the posture a little more. And then coming out of the posture with a flex knee is possible as well. Slowly lift up and move out of that posture. In triangle, don't you find people find their boundary of tension and are thinking, how long do we have to stay here? How long do we have to stay here? And when it's possible to move, they move out too quickly. If injury were to occur in any posture, it's probably going to occur in the third phase, the moving out. So we want to move out super slowly. And then we still have that core connection. We could balance immediately to the other side, or put the triangle to the other side a little bit later in our whole triangle experience. Remember, 3 triangles in any yoga triangle, and flexing a knee is an option. Notice that there's very little difference between this triangle and the next pose, extended angle. So for pose number 15, extended angle, let's practice the lower body setup without cueing it verbally at all. We're already there. Hands are out to the side. Just like in triangle, we float as a feather forward and down. And all we do for the regression, as Manuel showed you in the triangle, you can flex the front knee, flex the anterior knee here, and you can bring the elbow to the hand if you want to, and support your elbow here. Less degree of lateral flexion. Now bring your top hand to me and pass me. He was just in triangle. Now he's extended angle. Bring back your hand and talk to me. Now he is in triangle. Bring your hand back to me. Now he's in extended angle. Notice in the photographs between 14 and 15, the difference is minimal between triangle and extended angle. What is the full progression of this, Manuel? Extend the knee and touch all the way down in front of the leg, next to the leg, on the leg, behind the leg, on a yoga block. That's all between you and your leg. Coming out of this, super moss, the same as triangle. Hand comes neutral, and using the quadratus lumborum, deep intrinsic core stabilizers to pull you back up into neutral position. Bound triangle number 16. Would you like to reposition your feet over to the right side so we get another option of lateral flexion? The difference between bound triangle and a triangle pose is minimal, except we're adding a binding movement or a wrapping or a communication or a hand placement. It's mudra. Yoga for the hands, also for the eyes, transcends this course. We're doing yoga for the arms here. In our bound triangle, we're going to flex the anterior knee. So we bend this knee and hinge forward, and then we're going to start to wrap. You're going to hinge over towards the wall, and then you're going to take one hand under the leg, and the other hand goes behind you. Wonderful. So that goes anterior. You reach back, and Manuel is making contact like this. So that's wonderful because he's making some kind of physical tactile support of one hand to the other. Fighting for balance and stability is part of the purpose of the posture, and the anterior knee is flexed, and he rotated his spine. Everything he's in is the frontal plane. If there was a sheet of glass in front of him, he's not falling forward. I hear the ujjayi breathing. If there's a sheet of glass behind him, he's not marking the glass behind him. That's I, right? How to come out of that? You could come up first, or unwrap the hands first, slowly put the hand on the leg, and with additional assistance, push yourself up, extending the knee and the hands out to the hands, lowering the hands, walk, crawl, or jump the feet together. That's bound triangle. What happens in bound triangle is I would never facilitate that in my classes without having done first a full triangle and have everyone able to understand the setup or the S or the stability of the lower body for triangle. And then the bound triangle is pretty much a triangle, adding the upper body mobility integration. Do you feel it open up your shoulders and hips? But also you're going to add the front knee or anterior patella is in flexion, a little bit different from the traditional triangle. Now we have the reverse triangle, and that for you is number 17, 1-7, also referred to as the revolving triangle. The front or anterior knee can be in flexion, and of course, as all of these warriors and triangles can use chairs, that's always your M level or modification. Let's stay doing the triangle to this side. So walk, crawl, or jump your feet over to the right. We're going to flex the supporting anterior knee, hands out to the side, reach, and then we're going to think of two movements. The first is a rotation movement, and the second movement is going to be a lateral flexion movement. So we have two planes, transverse plane. I'm going to invite you to turn over your left shoulder, look to the back of the wall. I get out of the way for your arms. That was the rotation. And now you laterally flex to a point where you comfortably can touch the floor. Notice how his front anterior knee is flexed. The top hand is lifted. Thumb lines up right over the mouth. His heart shining which color light? Green, shines forward completely again in the frontal plane. Wonderful hip opener. I would never show revolving or reverse triangle without the traditional triangle first. How do we come out of this? Hold that rotation. Keep looking at me and lift up into neutral, keeping that lateral flexion. And then we untwist and revolve, and then extend the supporting knee. Once again, for safety of everyone, we'll show them the example of what we don't want. We don't want to twist and go down at the same time. This is why we don't do windmills anymore, really, because it's a number one way to bulge a herniated disc, right? Adding flexion with rotation against gravity unsupported. Hello, three triple whammies. Let's lift up and show them one more time how we really want them to do it. We'll do it the progression way now, keeping the anterior knee always in extension. I know he can do it. We're lifting up first, rotate towards me, and then when you're comfortable, you lift down and laterally flex. Rotation and lateral flexion, then fix your whole alignment of the upper body. How do we come out of it? Keep your rotation laterally flex, turn towards our friends who are watching, and you are out of the reverse triangle. Well, I'm going to invite you, without going or jumping your feet into mountain, as we get ready for the next pose, the runner's lunge, to turn over your left shoulder, their right shoulder as they see it, and we're going to go down towards the mat. This is a wonderful posture to see from the side as we all look at number 18. This is the progression where your hands are on the floor and the back knee or inferior patella is off of the floor and suspended. Make it a little easier, or the level A approach. The back knee goes to the floor. Hands can stay on the floor, but for some individuals with really tight hips, this will be a challenge. How can we make that harder? Hands come to the anterior patella and add some additional support to keep the spine neutral, ears, shoulders, and hips. While we're in this position, push everything forward. As long as the knee tracks forward over the middle toe, that's still engaging in a hip movement. Which hip is the stabilizing hip? The one that's flexed. next, the one he's touching. Which hip is the mobilizing hip, the non-supported hip, correct? That's the one where you should feel, if you're following along, the opening up of the hip. A little progression, still with the knee on the floor, is to add that mild back bend that we did in the Warrior One. Ears stay in alignment with the hips and shoulders, and the arms could even go overhead as we do the back bend, adding that mild back bend, arms apart or arms together. Let's touch the patella again and take the back knee off of the floor as we show that progression of the runner's lunge. If you want to make this super accessible for everyone to start, let's bring the foot in so much that you can get the back heel to the floor. And now we're in a more traditional runner's lunge preparation, deep soleus and gastrocnemius stretch, where we still have all the principles of alignment. It's a preparation stretch, or your M level, for this pose of the runner's lunge. Let's turn forward towards our friends who are watching, and step or walk back up into mountain pose. From runner's lunge, we have the legs spread wide. And one of the wonderful aspects of legs spread wide is it gives you wide base of support to practice functional bending from the hips, not the waist. So as we get ready for this posture, we're going to walk, crawl, or jump the feet out to a big wide stance, having the feet pointing forward. This is sort of one of the few times where we're not having you angle one foot or the other. If I took a picture of you from the hips to the heels, I'm going to ask you, is one side of your body symmetrical to the other? And the answer is an affirmative, I hope. So we have the whole core engaged pelvic floor. We're going to take the hands to the knees, and as we do in monkey, or as we do in the preparation of a forward bender table, hinge forward from the hips, not the waist. So once again, I could have the bee on bee, or breakfast on his back. Put the blueberries on the neck, puts the raw egg on the lower back, and maybe some cornflakes in the middle, and nothing's falling off because he has nice extension supported by the spinal erectors and his hands. Progression, he's going to go into flexion, keeping his hands on the legs, and trace the body down for those whose hamstrings allow or facilitate this posture. And notice how he might widen the base of support, how he's holding some place of the legs in this case, and in the photographs you'll see onto the ankles, and the head goes towards the floor. Some individuals may be able to place their crown chakra, or top of the head, on the floor. You don't see it in the pictures, and you see Manuel is very close to the floor. The spine is engaged in flexion with support of the hands on the floor. How do we come out of this posture? We're going to flex the knees a little bit and slowly trace the hands up to the knees until we can come into an extended position. And then from this position, stand up into mountain, avoiding unsupported forward flexion, making it a core training exercise, moving in, maintaining, and moving out. Manuel is warm. The breath keeps you warm. The movement of the muscles keeps your whole core engaged in the wide legs position. Wide base of support, but going forward could be a little bit daunting to some participants. So the regression for this, even similar to what we show in the picture, is to remember just the standing level A of the forward bend. Walk, crawl, or jump your feet to standing. Hands come to the legs, and then hinge yourself down to a comfortable but challenging position. Extension first, and then round the spine. You could keep the hands on the knees as he's showing you, or trace them all the way down into flexion as he's showing you. Very similar with a narrow, less daunting, less intimidating base of support. I would always teach this, which is part of our morning phase, before we would teach here a deeper phase of our day with the wide legs. Hands come to the knees, and then engage in an active spinal extension into a table position. Once again, B on B, breakfast on the back, and then inhale towards extension, and we're up in neutral. You'll notice that there is a third version in the leg spread wide pose where you actually stand wide and just hinge forward. You could just hold this position, go ahead and open up the legs just a little bit more, keeping the elbows pointing to the sides of the room, and hinge forward, and that's where you go. You could keep there, slightly round the spine, as you'll see in the picture, but you are supported, so it's okay to round the spine sort of like a standing cat, and then come back to neutral. Inhale back up. That concludes number 19, or legs spread wide. Moving on to the tree pose. Number 20 is a symbol, it's a metaphor, and it's a pinnacle of Hatha Yoga. Why? Some people say I wasn't born with good balance. We always say you have to train it. Were you born able to ride a bicycle with 2 wheels? No, it's something that's an acquired skill that we should perfect every day. How is this tree pose a metaphor for your life? If you have balance in your body, I always tell my clients, you'll have balance in your life. It transfers. Yoga on the mat may be an hour, maybe every day, but how this becomes helping you a COL or a champion of living off of the mat is the true metaphorical significance of the tree pose. Let's start with balance on your left foot as you're facing us, and the right foot turns perpendicular. Here are the key symbols, and I'm going to drop down to the level of his knees. Notice how his feet are perpendicular to each other, and he has the stabilizing knee in the sagittal plane. The opposite hip is in the frontal plane. Not dangerous, not contraindicated, because he's touching the floor. His hands are at the side. His hands could come off his legs. That would be a progression. Thumbs to the heart space or arms overhead is the blooming tree. That's a progression, because if he takes his arms really high and then opens those arms, he has a lot more space between the hands and the feet. Manuel, open the arms like the blooming tree, super challenging, but still painting in face. You see his alignment. Do you want to come back to thumbs to the heart? Wonderful, thank you. That's the way he began, and his knee is pointing out towards the side. Let's get into some progressions of the lower body. To make this more challenging, one thing you could do is just take the heel off of the leg. That's a progression because you're decreasing the contact points. Another progression, as Manuel showed you, is the foot comes up to the leg. The supporting knee is flexed. See this? Space between. Another progression halfway between whole foot on and whole foot off, and then the ultimate progression, sort of the B level or the goal level, is to pull the foot manually with one or both hands up towards the sacrum, keep the knee pointing to the outside edge. Stability left side, mobility right side, stability upper body, all the way through the pelvic floor. Really important to avoid common misconceptions is the knee pointing forward, as he just showed you. You see it all the time, and people hyperextend or lock out the supporting knee. That puts pressure on that knee, and should someone fall over or stumble, we don't want to stumble on a lock joint or a hyperflex joint, which means it's very important to remember where we're going to put this foot. The right foot can go anywhere along that left leg that it wants, except to adjacent to or pushing on the medial side or the inner side or the inner thigh, the ligaments of the patella. Dangerous because you could actually do some damage putting pressure on the side of your knee. Upper body remains safe and in alignment, ears, shoulders, hips. If you do a tree on one side in a different phase of your class, that's wonderful. You want to do the tree on the other side. It doesn't have to be done immediately, as we showed you in our little demonstration of class number 1 of the tree pose. Ultimately, contracting the pelvic floor and drawing the navel in helps keep your balance and stability recruiting from the hips down and from the hips up, because balance on the mat helps transfer ultimately to yoga in your life, balance off of the mat. From number 20, or tree pose, we move on to the next pose, which is called the finger to big toe. In Hatha Yoga, we call the big toe the Parangutasasana, which actually altogether becomes holding the big toe and trying to balance pose, which we'll practice speaking together. It's a big tongue twister. The important thing to know is balance is acquired, and there are safe approximations to get your classes and clients into this pose. I'd like you to tell me, which foot do you want to be the stabilizing foot?
Left foot.
And your moving foot will be your right. Because he's going to be here for God knows how long I'm going to be speaking, I'd let him choose because he's my perfect model in this position. So your right foot is your base of support as you're looking at us. In this case, it's his left. The other foot comes up and you just hold under and behind that leg. We've already addressed why we don't want to hold on to that knee, because people may be attempted or tempted to pull that knee into hyperflexion. This may be where you start. This is the posture version that I did for years. The next progression is just to angle this out to the side, keeping the leg at short lever as a hip opener unilateral. I'm always here if you need to touch me, because I know your supporting ankles will get tired. We may not hold our classes and clients this long. Another progression on another day, for those for whom it's appropriate, is to bring that knee back to where it was and reach forward towards that big toe, internally bringing the foot and externally rotating the knee. Then we're going to hold on to that. I'm going to move to this side only if you need me, and we could be here for a week or two. And the next progression, for those for whom it's available, is to take it forward. You see all these successive approximations in the book. Notice how the non-trailing hand, if it's not supporting anything, could go up into the air, and this makes a huge progression now because you have one leg grounded and the same side up, and then finally you could add that hip opener that we worked forward as we go out to the side, working on standing, challenge, balance. The third phase is moving out, flexing the knee, bringing it to neutral, and then slowly lowering the arm and leg. Repeat that at some point to the other side. Now you may say, that's a pose for the front row. That's a pose for the dancers. That's a pose that I can't even do. My best progression of that pose on some day may be something that looks like this and this without holding anyone else, fighting for recruitment of stability and support. Well, you know what? If that's what I'm going to work on someday, I will start it here one day. The next progression, as Manuel showed you, bring it to the side until I get up to a point where I find centered, pelvic floor, navel in, and I can just hold a toe. This may be where I be 1 week, and another week this way, and another week extension in the sagittal plane until I take it out to the side in transverse plane and feel I could stay here for a few more breaths. Slowly bring it in, and it will flex it and lower down. 3 phases of every pose. It's a huge pinnacle of Hatha Yoga, but I would never put this as a precursor to a tree pose, for example. Tree pose for a long time. That's the finger to big toe pose. Remember, chairs and stable options are also available. The next pose is downward facing dog with leg up, sometimes referred to as the single leg dog or the three-legged dog because 3 limbs or levers are actually in contact with the floor. Because we've already addressed all the alignment of the lower body in downward facing dog, we're going to come down to the floor and just show you this little option progression for those whose hamstring flexibility allows. Manuel, I'm going to invite you to turn towards your right shoulder and step up front together. One option to get into this is take the leg closer to my friends, your right, all the way back. Let's go to the floor. Touch the floor as you hinge, bring the feet together into a plank pose, knees off of the floor, and then hinge back into downward facing dog. Once we're in this position, you feel grounded, the heels close to or on the floor, knees can flex, the elbows are in nice extension without being hyperextended. Let's take the hip that's closer to our friends and bring it off of the floor. 3-legged dog or 1-legged dog. With his hamstring ability, notice he finishes in the B pose or the goal level, from heel to hand down one side of the body, a beautiful extension. We could make this easier for some people, couldn't we, Manuel? Flex this knee. And then those with limited flexibility in the hamstrings can still approximate the pose. You don't have a picture of that. We show it with a chair, but this is also a way that some people can get to feel what it's like with the 3-legged dog. Let's extend this knee, go back down to the floor, and take your knees to the floor for a little rest. I just like to tell you that sometimes we hold this pose with one leg up. The next time we come back to the downward facing dog, we may offer the other leg up. Some people hold the posture in vinyasa prana, which means inhale one leg up, exhale, bring it down. Inhale, other leg up, exhale, takes it down. Let's just show an example of that, Manuel. Let's hinge down into downward facing dog. When you feel comfortable, when you're ready to inhale in ujjayi, one hip extends, and when you're exhaling, it goes down. When you're inhaling, the other hip's up. Now, if continue just 3 more of those, please, Manuel. While I invite you to remember, we don't cue to our class, inhale now, exhale now. I like to say your assignment for the next 30 minutes is either to rest on your knees or try vinyasa prana. When you inhale, you're lifting one leg. And if everyone in the room is doing different things, that's okay. The control freak of me of traditional group fitness lets aside my expectations and opens up to what I see in Hatha Yoga. Thank you. Knees to the floor, and I'll remind us all of the words of Buddha, who said, when you expect nothing, you have everything. So remember that when you channel and facilitate Hatha Yoga postures and you look out at your classes and clients, that whatever you see is many times what they need. Because when we teach or facilitate Hatha Yoga, I find that we teach what we need to learn, and in so doing, we learn what we need to teach. Moving on to number 23, the locust. Saltamontes in Spanish, and we have in the Sanskrit, which we'll practice later, the salabasan or salavasana. As Manuel knows, we'll go to a prone position. Hands stay there, because I don't know your lower back health. I'd like you to have some external, artificial, passive resistance support before we do anything else. First thing, pelvic floor engages. Contract the glutes and draw the navel off the floor. 3 things that give intrinsic, active, internal support to your core. The toes or the pedicure on the floor, on the mat, if your body height allows that, and then press the hands into the floor and lift up, like you're peeling yourself like a banana off of the mat, vertebra by vertebra. The cues in the manual are excellent at help you avoid compressing these lumbar spinal vertebrae, keeping them really long. The heart is a green light shining forward, or increase the range by extending the elbows, coming up a little higher, shining that light forward. That's a preparation for the saltamontes. Let's lower all the way and get into the traditional saltamontes. Hands by the hips, Manuel, palms up, and keep the toes on the floor. Now actively with your own intrinsic core muscles, peel yourself off the floor, drawing the navel in, and we're in this tall, extended position. While you're in this position, the important thing to think about is contract through the pelvic floor, contract the glutes, and also the navel is squeezing in. That's crucial because you're against gravity. So sometimes before we even put our hands behind us, I have my clients squeeze, release, and then hold that compression of transversus abdominis against gravity. If you want to lower down and rest for a moment in this position, look to one side, Manuel. That keeps your neck nice and neutral, and rest there just for a moment. Now we'll talk about adding the legs. It is absolutely traditional, salabasa, or traditional locust, to bring everything off the floor, balancing your whole core on your ASIS, anterior superior iliac spine bones. However, it's not traditional, meaning it's not appropriate for all people. We always analyze the AFAA 5 question. So the next level of progression would be this. Let's lift up actively with the upper body. Notice how he reoriented his cervical spine looking down. Upper body up, and let's just take your right leg, Manuel, off of the floor. Wonderful. The camera, closer leg. And so this is still active, right? Glute and transverse abdominis and pelvic floor. And the hands came off the floor, which is a progression as well. You could take a few breaths here and invite your clients, after about 3 breaths, lower that leg, keep the spine engaged, actively isometrically, and extend the opposite hip. The full saltamontes, or the full locust, is to raise everything off the floor. So from head to heels, nothing touches the floor, like bow, where we're reaching for our ankles, and we're completely balanced here. The heart is off of the floor. The whole chest line is off of the floor, lifting super high. If your clients don't get this range, that's okay. I choose Manuel because I know what his range is. Let's slowly lower to the floor. You could do upper body and lower body together. The more introductory or novice your participants are at Hatha Yoga, I'd recommend lower one leg, lower the other leg, put your hands in front and lower to the floor, so you get that hand support at the very beginning, at the very end, just like Manuel will show you here. So you're lifting up into the, wonderful. So lift up into locust, take your right toes to the floor, left toes to the floor, hands in front, palms down, and then gently lower to the floor. So you can control that degree of coming back into neutral from that active extension, feeling the whole body bend back. Go take a rest for a second, Manuel. Look at our friends and lower your head. Why this is such a functionally efficacious posture is because, as I mentioned before, we're a very forward-oriented society, yet when you have clients start to do something backwards, many times they say, but I feel it in my lower back muscles. Well, we know at AFAA that there are no such things as lower back muscles. We have long muscles that go all the way to the arms. Those are called lats, latissimus dorsi, and we have long spinal erectors that go from the neck, cervical, through the thoracic, through the lumbar vertebrae. So what's very important that we understand that we want them to feel discomfort like doing crunches. They want to feel discomfort here. They think then they know they're working. As soon as some people start to feel some activation of the spine, we have to ask them, is it discomfort or pain, or do you feel it working? They have to tell their own body what they feel. Sometimes I'll say, does it feel like knives, or does it feel like discomfort, like you feel when you work biceps and you know you have that nice, comfortable burning sensation? We want people to get in touch with their spine in postures like camel, where they're actively back bending with support of the hands, or even more actively back bending with no support supportive hands as in the locust posture. We don't have to spend a specific number of minutes in the back bending locust posture, but we want to make sure people understand that because we're always bending forward, bending backwards is a necessary part of life because Hatha Yoga should balance us. One last thing. I ask you, do your clients, more of the majority, walk into your classes like this and say, I'm ready for yoga? Or do the majority of your classes walk in and say, I'm ready for the Hatha Yoga practice today? I think it's the former, correct? Because of kyphosis, because of lordosis, because of always being forward-oriented in what we do. Send. Guess what? Postures like the locust are empowering and enriching and help us become champions of living off of the yoga mat. That concludes this little chat about the locust posture. Thank you, Manuel, for that. We're going to move on to the child's pose, and I imagine at this point that you might be welcoming the child's pose with the rest. Number 24. As we move up and back, let's put our weight on the knees and just glide ourselves back. Pushing up with the breathing, walk the hands in the direction of the knees, and let's show the easy version now, or the level A. So notice how he brings his knees a little bit closer together, and he's going to reach his hands for, where they are right now is fine. Lower the head to the floor and reach your hands to the ankles. Wonderful. So this is sort of the A level of child pose. Somebody has knee issues, glaucoma, any reason to avoid inversions, pregnant, you can start a child pose on a side lying. We don't show you that, but instead of having your client just do nothing, you can always have a client stand in a mountain pose, go to a corpse pose, sit cross-legged in sort of a seated palm posture, or try to remember the variations of this. If you want to bring the head higher than the heart, we've already shown you how you can make fists and bring the forehead higher than the floor would make it, or at the level of the heart, right? Head at the heart at the same level. We can place bolsters and pillows between the glutes and the heels. However, the more B level, the more basic level, our goal in the child pose is to reach the hands forward, sit back and have contact of glutes onto the feet, if your glutes and feet allow, and then forehead seals itself, S-E-A-L-S, makes a seal onto the floor. Remember, there is no should, there is no have to, but the goal is to flex the spine, the knee femurs, the bones push into the patellas. If you have knee issues, you shouldn't. If you have healthy knees and hip relationship there, of course, the child is very, very common. It's a great rest pose. It's a great transition pose. Why we call it a child pose is not because children come to this position and pout, as I used to think before my study of yoga in India. Can I invite you to touch your ankles? When you make contact, go ahead and pull with your elbows, like elbow flexion, and bring your nose closer in between your knees, so a deeper rounding, and then you lower back down. The hands help you. Then relax the hands to the floor, palms up. And now, because you've gone into a deeper degree of assisted spinal flexion and you breathe, this is the position of a fetus in 3 months. That's why we call it the child pose. And when you breathe, it's restorative, it's invigorating, it's relaxing if you're between a heavy vinyasa, and also it helps you inflate the posterior lower lobes of the lungs. Why is that important? Guess what? Normally when we breathe and we're forward oriented like this, we're shallow breathing. In traffic, we're shallow breathing. For example, under stress, when that whole sympathetic nervous system kicks in, this allows you to inflate the back lobes of the lungs and breathe deeply. Some of the breathing techniques we talked about before could work here. Try Ujjayi, sometimes child. Try, because this warms you up, Sitala. The cooling breath in a warming up posture like child. Try the deep breathing, super hard, low, middle, high, and exhale high, middle, low of the lungs in the child posture. And alternate nostrils one we would not do in this posture because you're not going to free your hands and start manipulating the nostrils, and that can't be done at will. So 3 of our 4 pranayamas outlined from Sunrise Hatha Yoga practice. To get out of this, I invite you to take one hand by one ear, the other hand by the other here, and remind yourself that there is no rush. Stop there, take a few breaths when you inhale and pause. Come up a few more inches, pause there and exhale. There's not always a rush to get out of child. We took a long time to get into it and a long time to maintain it. So why would we try to get out of it in 10 seconds? Slowly come up a few more inches, pause there, exhale. Allow yourself to reacclimate from the inversion to seeing life as we usually see it, and your blood pressure to reorient. From the liquid of the eyes press forward to settle back behind the cornea. from the craniosacral liquid of the brain to reestablish, for all the hormones to reestablish themselves the way they were in the body. Yes, this invigorates the metabolism. Yes, this floats the kidneys. Yes, this makes the body relax. However, we want to get out of a pose just as slowly as we got into it if it is a transition pose. And child pose is a wonderful transition pose. Getting into it slowly, holding it, and getting out. One of the cues I give to my clients is when we're getting out is I say, if we're going to give a prize for getting out, we're going to give a prize today for the person who finishes in the hero pose last, not first. Automatically, because we're in hero, you want to get in the habit of pulling away the glutes away from the ischial tuberosities and sits bones and get into a position that makes you feel like you are in another posture called the hero. And that finishes the child pose. Number 25 is the bow, given its name because of bow and arrow, not bow on a package. We're going to go ahead and walk our hands forward to a prone position. And we're just going to lay out on the mat. And we're going to show the level B first, or the true progression. I'm going to invite you to reach your right hand towards the right ankle, left hand towards the left ankle. We could always use a strap or a towel to decrease that support between us. If we don't make it there, we can always bring something to us. Now we're holding on to the ankles, and the chest lifts up, and the quadriceps or the thighs come off of the floor as your body allows. Notice his neutral spine, especially the 7 cervical vertebrae. Super, super important. You should be able to hold a large grapefruit between your chin and your chest at all times. Yet if I held my fingers forward and said, how many fingers do I have? He still sees those fingers, right? But we're not compressing the vertebrae in the back of the neck. In fact, there are no wrinkles in the back of his neck showing me that he's looking forward and down, not hyper extending the cervical spine. Breathing as he's doing the posture. The posture does you. There's space between the knees or wider than the hips. That promotes a whole massage of this internal area. You could bring the knees a little bit closer together. That's a progression, not appropriate for everyone, because we've already said the more you spread the knees in a position like prone with extension, the more you have relief of the lower spine compression. How do we make this easier for everyone, Manuel? Let's take one hand forward and put it on the floor and just breathe. Wonderful. So for the person whom a full bow is difficult, you can take one arm forward a little bit closer to the body or far away from the body the way Manuel did to push down into the floor and lift up. Common misalignment here is people try to rotate towards us as we rotate towards you because you are unbalanced, right? I mean that in the nicest possible way, of course. You have one hand forward. You want to square off also the hips and the shoulders, especially the non-supported shoulder, towards that edge of the mat. That's the unilateral or one-arm bow. Let's do the other side just to show everyone what that looks like. One arm forward, reaching back, and you'll notice, my friends, following along in the photograph of letter A, that you don't have to have one hand forward. Can I have you take this hand behind you over your glute right there? And that could be an approximation between the first way we showed you and the second way. What color are we using throughout this course to verify that? Sort of denoting that with the gray color. Here's your gray. Not a hand forward, still trying to keep core integrity of neutrality of shoulders with the edge of the mat, and the back thigh is off the floor, contracting the glutes. Coming out of this gently, we want to lower the upper body or let the lower leg go, but not just release and lower down, because if injury were to occur, they may occur in the third phase or the moving out. So rest there for a moment, Manuel, as we come out. Notice how he takes that and makes a little pillow with his hands, relaxes the glutes, relaxes transverse abdominis, relaxes pelvic floor, but keeps integrity of the ankles. Notice how everything is in alignment. So you have your ankles in plantar flexion and relaxing out of that pose. I may do a combination of the previous pose, which was our number 24, child pose, flexion, with number 25, a bow, active extension. When we do poses that verify and they balance each other's spinal movement, we call it usually pose, counter pose. Not all of Hatha Yoga has to balance that way. We can do a couple classes of just flexion. Although it's not very functional, since our clients are already coming into flexion, we could say the theme of our yogic experience today is back bending and extension. And for every 3 asana of back bending, we may do 1 child, for example. However, if you ever do balance an example, of a lateral flexion right, immediately with a lateral flexion left, i.e. triangle right, triangle left, guess what? You can say this is a pose and a counter pose because I, as your yoga facilitator today, know what you need. The next two postures are pigeon and bound pigeon, and we're going to put these together because 26 and 27 are very, very parallel. I'm going to invite you to put your hands under your chest, Manuel, and push up from knee, chest, chin, all the way up into the plank pose. And now let's take the knee that's far closer to me, farther away from the camera, your left, in between the hands. The setup for this, of course, no one has hip issues, recent surgery of the knees, or any other shoulder issues. And notice when you look down, you want the knee pretty equidistant between the hands. So when you look down, you can't say, my knee is closer to my left hand. Well, you can say that, but a goal is to try to have the knee equidistant. There are many schools of thought and other variations and progressions and regressions of pigeon. So bear with us as we go through the method of pigeon and bound pigeon that are appropriate for this course. Why? Maximizing benefits and minimizing risk. Some schools of thought say the non-supported glute, in this instance, Manuel's left, has to touch the floor. I always say the caution light should go up, the green light, the yellow light, rather, of the stoplight metaphor, whenever we hear should. You have to put the left glute on the floor. Most instances won't touch the floor, depending on the body weight or body fat percentage of most of our clients. He's in a pigeon and he's breathing. There are variations of moving within a pose. I like to use another M word and say this is milking the pose. We can go into what I call the sleeping pigeon, actively working spinal flexion, but using the hands to go forward. Did you notice how he took his hands forward and assisted that spinal flexion? Just as we don't stand and do unsupported forward flexion, we use the hands moving forward, and this keeps us in this position. We could put something under the forehead if we don't seal our forehead to the floor, or as he's showing you here, use our hands to make it less of an inversion. But one of the purposes here is really opening up that posterior hip. Are you feeling like gluteus maximus open up? A lot of my instructors who teach cycle and then they go into pigeon, they realize why they want to do pigeon, because it's a real big hip opener. And now we're going to come out of this very slowly, just like child. Hands by the ears, come up a few inches, and then hang out there. And then perhaps you come up a few inches and hang out there. Notice then in pigeon how we did the variations that you have for number 26 for letter A or A1 and letter B. There's a supine version which we won't take you through, but it's easily identified as you're on your back and bring one leg in. Now from this position we can go from 26 to number 27, the bound position, the ekapada, where one hand stays forward, this hand will reposition in front of the knee, and then you reach back as we did in our class 1 before, towards that flexed ankle. You could pretend to reach for it. You could reach for it with a towel here or a strap here. And as you're reaching, the spine will flex a little bit and start to laterally flex, but our goal is to keep the hips angled towards the wall and the shoulders angled towards the wall, as you see with Manuel. How do we make it a little more challenging? We could take this foot, the front arm forward off of the floor and just reach forward. And now it's a core engagement of holding the back leg and forward. Here we're in the B level now. And of course the M is still from the previous, a supine version, bringing the legs into the chest. Let's do the other side just so everyone can see what that would look like. We slowly release the hand, hands come here. As a progression here, let's lift into a plank pose, lifting the legs so we extend the hips and then onto a full plank. Nice. Notice the nice alignment here, head to heels, and now your opposite or your right knee comes in between the hands, and then we position the body respecting what the body does. There are no have tos, and then we reach one hand forward and reach the opposite hand. You can go forward all the way. Wonderful. For the sleeping pigeon first, feeling the glute open, relaxing the head. Can you come in just to a forearm plank, like antebrazos, elbows to the floor? And this you see in the manual as well as an option of the person who doesn't want to go all the way forward or come all the way up and try to do a bound pigeon. This sort of is our gray, right? With wrist issues or spine issues, this doesn't put any pressure on the lumbar spine, and it's a great variation of pigeon that a lot of people can still feel what's supposed to happen, the mobility of the hip with the stability of the the upper body. Now let's come up, Manuel, and try to show our friends the bound pigeon. I'm going to move back because you're going to be rotating towards me. The hand repositions, notice, and then he rotates away from you and then pulls, reaches back towards the foot, finds that connection, and then turns back to the hips, aligned in stability. Breathing in Ujjayi, I'm hearing it the whole time. I hope you are. Core is engaged. The heart is shining a green light towards the side wall, and then the option is to reach forward for a full royal bound pigeon. A little extra I'm giving you here. The hand can come to the floor, and then slowly we'll release the posterior leg, and then slowly take the hands forward. Let's push back into child's pose just to show how we could make that a vinyasa. We hinge back, knees go together, hands don't have to move at all, and it's a wonderful transition from a pigeon to a child and a pigeon on the other side to give you more vinyasa choreography. Moving on from the pigeon to the camel, number 28, one of the pinnacles of Hatha Yoga, and a little parenthetical statement I'll tell you that no one really cares to know. Camel is my favorite animal. We'll show you camel from the side because we did it together earlier from the front approach. So to do this, I'm going to invite you to pad the knees because you might be practicing all this with us today, and we respect our knees, don't we? And most of us practice on hardwood floors of traditional studios. So I'm going to invite you to take the front, and I'm going to fold it 1, 2, 3 times, and that's where you're going to place your knees, hip distance apart, my friend, all the way forward. We don't traditionally pad the knees, but normally we're not going to spend this much time in a camel. Manuel, I'm going to be talking about camel for the next 20 minutes. Just kidding. Nice smile. We're going to engage the core and pelvic floor, and this is how I cue some visual intrinsic cues. Imagine you're in the front of the group fitness studio with me, and in the front of the room, you have the mirror meeting the hardwood floor. So we're there, correct? This is all glass, and this is all hardwood floor. There's your little baseboard right here. Your kneecaps are against the baseboards. Your hips are pushing into the baseboards. Your hips are pushing into the glass mirror. The chest line is pushing towards me into the glass, and your nose is touching the glass. There's a grapefruit between your chin and your chest. And now you have neutral stability from the core, drawing the navel in. Pelvic floor is engaged. The stability comes from hips to heels. Where are we going to get the mobility? We're going to peel all of this up like a banana away from neutral. How do we remember that down here we have 5 lumbar vertebrae, and through the middle of the chest we have 12 thoracic, and up here 7, my friends? Well, in back bending it's crucial that yogic instructors understand that we have 7, 12, and 5, and that's how the vertebrae line up in neutral. Down here is the coccyx and the sacrum, so guess what? I like to say, remember always this, at least for the United States. Breakfast at 7, lunch at 12, dinner at 5, you're good to go. We're going to keep a natural neutral alignment of your breakfast, lunch, and dinner vertebrae. Reach your hands behind you and shake hands with your elbows. This gives you artificial support. You can hold your glutes that way or touch your elbows as you continue to reach forward, and that gives you a little more support. What Manuel first did was holding the glutes. That gives you intermediate support because he's so strong in this whole core area. We're going to take your hands to the glutes the way you first did. As a progression here, no squeezing, but just hold on there. Shoulders are back and down, lots of space between the ears and the shoulders. What's touching the glass? The hips to the knees. What are we going to peel away? From the knees to the nose, all the way hinge back. Wonderful. How far he goes is between him and his nose. But notice, like a banana peeling back, the base of the banana is from the hips to the knees. This is all the mirror of the movement studio, correct? So there's stability from the hips to the knees, but here's his extension. If I held up fingers here, he can still tell me how many fingers I have. How many fingers am I holding up? 2. It's always been 2 today. So 2 here, because he can move his eyes and see up, move his eyes and see forward. You may say, oh, but Lawrence, it's traditional Hatha Yoga to let the back of the skull crush into the spine. It is traditional. However, in this course of Sunrise Hatha Yoga, we are putting together the benefits over the risks. So we want to maintain neutrality of our 7 cervical vertebrae, the thoracic 12, and the evening or the lumbar down here. How do we come out of this? We're not going to get out of it yet. I'm going to show you a progression. Come up onto the backs of the toes into a more difficult active dorsiflexion with the anterior tibialis. Walk the hands down the hamstrings. Walk, 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 walk. Wonderful. And then sort of reach out there, and you can find one Achilles. Reach out the other, if that's available to you, with the other Achilles, but you still have that grapefruit right here. You still have the core engagement right here, and you still have this neutrality right right here. So if you think about this posture, if I flip Manuel or the whole world this way, we're in the bow pose, Dhanurasana, correct? But now we're on a weight-bearing, knee-bearing back bend to improve our posture. How are we going to get out of this? One hand walks to one hamstring, the other hand touches the other hamstring, and then we walk the hands up to the glutes, contracting here, bringing the ribs into the hips, draw the navel in, contract. It's a great crunch, isn't it? You feel your rectus abdominis. People are always saying, give me new ab exercises. I'll give you one on your knees, and you'll only do it once. So you take a long time to isotonically, eccentrically come out of contracting that rectus abdominis, and when you're coming up, it's concentric, and then you've come out of the camel. So I'm going to invite you to grab your glutes, sit down, turn the toes behind you into hero pose. Plantar flex, wonderful. And then reposition with the glutes out. That's the camel pose. That's the true progression of camel pose. What's the easiest version of camel pose? Think about it. What's the hardest version? Do what Manuel just demonstrated with eyes closed. And what is sort of the A, or general approach level to the pose? The A would be pad the knees, come up, watch me. You would take your hands to the lower back and just hinge back a little bit here, or even sit in a chair, or as we demonstrate one in the picture, the M is one leg forward, hands behind you, a mild back bend, because then you have less pressure on the knees. But you can even do this on a chair, sitting sideways on a chair and hinge back. I'll just show you on this stool. Can I invite you to hold this for a moment? Check this out. So if you have a chair with a traditional back behind me, you could turn to the side. So here's the back, hold it here, and add a little camel here. Take the knees out of it, take the balance out of it, take how far back out of it, and all of a sudden, my mom's version of seated assisted camel could be very similar to what Manuel is doing in the B level or progression. Because guess what? He or she who needs more gets more, and he or she who needs less gets less. Are you ready, my friends, as we conclude the camel posture, having finished to number 28?